Hello everyone, my name is Anh Ho, and today I will be presenting a drug called Brebzavvy. So for introduction, so what is Brebzavvy? Brebzavvy, also had a generic name called Bexagliflozin, belongs to a drug class called sodium glucose cotransporter 2 inhibitor, or SGLT2 inhibitor. It is used as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. It was first approved by the FDA in January 2023. So currently, Brebzavvy is only available as oral form with one strength, which is 20 mg. For dosing, you, you take one tablet by mouth once a day in the morning for type 2 diabetes. For patients with eGFR greater than 30 ml per minute, no dosage adjustment necessary. For patients with eGFR less than 30 ml per minute, the use is not recommended. In particular, for patients on dialysis, the use is contraindicated. So let's talk about some patient counseling points. You can take it with or without food and in the morning. Do not chew or crush the tablet. Drink lots of fluid to stop dehydration. And if you miss a dose, take a missed dose as soon as you think about it. Then you follow the diet and workout plan that your doctor told you about. These drugs may affect certain lab tests. Therefore, you must tell all of your healthcare providers and lab workers that you take this drug. If you are 65 or older, you must use this drug with caution because you may have more side effects. So how does Brebzavvy work? Brebzavvy is an inhibitor of sodium glucose cotransporter 2, which is the transporter responsible for reabsorption of the majority of glucose from the renal glomerular filtrate in the renal proximal tubule. By inhibiting SGLT2, Brebzavvy reduces renal reabsorption of filtered glucose and lower the renal threshold for glucose, and therefore increase urinary glucose excretion. There are four major adverse reactions associated with Brebzavvy. The first one is called dehydration. Brebzavvy can cause some people to become dehydrated. It may cause events consistent with hypovolemia, including symptomatic hypotension and syncope. As a result, dehydration can make you feel dizzy, faint, lightheaded, or weak, especially when you stand up. Therefore, make sure you drink lots of fluid to stop dehydration. The second adverse reaction is ketoacidosis. Cases of ketoacidosis have been reported in patients with type 1 and type 2 diabetes mellitus receiving SGLT2 inhibitor, including Brebzavvy. Ketoacidosis can happen with Brebzavvy even if your blood sugar is less than 250 mg per deciliter, which can lead to misdiagnosis and prevent timely treatment. Some signs and symptoms of ketoacidosis are nausea, vomiting, abdominal pain, and tired. If you have any of these symptoms, stop taking the drug and call your healthcare provider right away or go to the nearest hospital emergency. The third adverse reaction is yeast infection. Brebzavvy have been associated with increased risk of genitourinary fungal infection, such as vaginal mycosis, vulvovaginal candidiasis, and vaginitis in women, and Candida balanitis in men. When this happens, talk to your doctor as soon as you notice signs and symptoms of yeast infection in the vagina or penis. Your doctor may suggest you use an over-the-counter antifungal medicine. And the last major adverse reaction is amputation. Although it's rare, Brebzavvy may increase the risk of lower limb amputation. Specifically, amputation primarily involves removal of the toe or part of the toe, a part of the foot, or less frequently the leg. You have a higher risk of lower limb amputation if you have a history of amputation, heart disease, diabetic foot ulcer, or if you are greater than 65 years old. Brebzavvy can cause some minor side effects, such as diuresis, urinary tract infection, skin rash, bone fracture, or kidney injury. Next, let's talk about some monitoring parameters of Brebzavvy. We must monitor blood glucose, renal function, volume status, and blood pressure when we taking this medication. Likewise, you must monitor lower limb and feet, check for sore, ulcer, or infection. Also, you need to check for signs and symptoms of ketoacidosis, such as nausea, vomiting, abdominal pain, malaise, or shortness of breath. Also, you must check the A1C level. Monitor at least twice a year in patients who have stable glycemic control and are meeting treatment goals. For patients who have unstable glycemic control, you monitor quarterly. Here are some warning and precautions of Brebzavvy. If you are allergic to Brebzavvy or any component, don't use it. Likewise, it is contraindicated for patients with dialysis. For precaution, as mentioned before, Brebzavvy can cause dehydration. Therefore, you should evaluate, correct, and maintain both surgical fluid requirement and volume status prior to initiating therapy and closely monitor the patient for the duration of the therapy. For hospitalized patients, the use of SGLT2 inhibitor is not recommended. For surgical procedure, consider temporary discontinuation more than 3 days before surgery. Also, make sure risk factor for ketoacidosis are resolved before initiating the therapy. Now, let's talk about some drug-drug interaction of Brebzavvy. Brebzavvy interacts with many drugs. However, this is a pretty safe medicine. For example, some beta blocker and monoamine oxidase inhibitor may enhance the hypoglycemic effect of Brebzavvy. This is a moderate risk. Therefore, we need to monitor this combination. Likewise, SGLT2 inhibitor may decrease the serum concentration of lithium. This is also a moderate risk which you need to monitor the therapy. However, Brebzavvy may enhance the hypoglycemic effect of sulfonylureas. Therefore, we should consider a decrease in sulfonylurea dose when initiating therapy for an SGLT2 inhibitor and monitor patients for hypoglycemia. This is a high risk, therefore we must consider therapy modification. And this concludes my presentation. Thank you for listening. And here are some of my reference. Thank you for listening.